Welcome to the Deep Dive, where we take your curiosity and the material you shared and pull out the truly fascinating and important bits just for you.
Mm-hmm.
Today, we're cracking open a real treasure trove, Anne Hooper's Sexopedia, everything you wanted to know.
Exactly. And this isn't just, a surface level guide.
No.
It's a pretty deep exploration of sex, relationships, attraction, really the whole spectrum of human sexuality.
Right.
Our mission today, I guess, is to pull out the key insights from this comprehensive book that will not only broaden your understanding, but maybe even surprise you a bit.
Yeah, hopefully leave you feeling, really well informed about this pretty fundamental part of life.
Mm-hmm.
Okay, let's unpack this. And maybe the best place to start is with female sexuality.
Good starting point.
The book points out that historically our understanding was surprisingly limited, but thankfully that's really changing.
It really is. What's particularly striking, I think, is the discussion around recent advancements.
Right.
Well, things like drugs specifically designed to reduce sexual inhibition in women, which could, potentially allow them to experience orgasm for the first time.
Wow. That really highlights how much we're learning, doesn't it?
It does, and how we're beginning to address the complexities of female sexual response in completely new ways.
That's a potential game changer, isn't it? It's not just about overcoming difficulties, but also enhancing pleasure.
Exactly.
The book also touches on the huge growth of the sex toy industry. That
Well,
feels like something that's really moved into the mainstream now.
Oh, absolutely. Sexopedia really underscores how the old stigmas around sex toys have, well, largely faded.
Yeah.
The convenience of mail order and, online shopping has definitely played a part.
Sure.
But the real driver, the book suggests, has been the incredible leaps in battery technology, making these devices more powerful and versatile for, well, everyone.
Okay, let's move on to another really captivating area, falling in love. The book breaks it down into three distinct phases. Can you walk us through those?
Certainly. So first, we have attraction, that initial spark, that draws us to someone.
Right, the spark.
Then comes infatuation. The book calls it a chemical addictive rush, which I think is quite accurate.
That sounds about right.
It's powered by various neurochemicals in the brain. And then finally, there's attachment.
Attachment.
That's the longer-term bond that ideally forms as that initial, really intense infatuation starts to mellow out, usually around the 2-year mark, apparently.
2 years. Okay. Chemical addictive rush. It sounds intense.
It is.
The book specifically mentions love chemicals, like pheromones. Are these really as influential as we sometimes hear?
Well, pheromones are thought to play a role, yeah, especially in those initial stages of attraction.
Sure.
They act as these subtle, almost unconscious chemical signals between people.
Okay.
But what's especially interesting that the book emphasizes is this idea of familiar love.
Familiar love. That's an interesting term. What's that about?
It's our tendency, apparently, to be drawn to qualities in a new partner that feel somehow familiar to us.
Familiar. Comfortable.
Exactly. It offers comfort, pleasure. And the book references brain studies here.
Ah, the science bit.
Yeah. When we experience something emotional, a part of our brain called the amygdala, it's this almond-shaped bit involved in processing emotions and memories, it becomes active. So it seems we find comfort and pleasure in the familiar because it triggers positive associations linked to our past experiences.
Ah, okay. So it's like our brains are saying, hey, this feels safe and good. I recognize this feeling.
Pretty much, yeah.
Now, the book also outlines a specific sequence of physical contact as sexual interest builds. It almost felt like reading a playbook.
Yeah, it's fascinating, isn't it? The almost predictable order the book lays out based on observed nonverbal cues.
So where does it start?
It begins with something as seemingly innocent as hand-to-head contact.
Hand to head, like touching hair.
Could be. The book suggests it can indicate a growing ease, maybe even a subtle shift in the power dynamic.
Okay, and then it progresses.
Right, then it moves to hand-to-body things like stroking, caressing.
Makes sense. As
Yeah.
intimacy and trust develop.
Exactly. What comes after that, according to the book, is a progression towards mouth-to-face contact,
Okay.
signaling a further increase in trust and sexual interests. Then comes mouth-to-mouth kissing.
Right.
And the book makes a really insightful point here. Because kissing out of friendship is quite common in many cultures today.
Yeah, true.
It can actually make venturing into a more serious romantic kiss feel relatively safe and natural.
That's a great observation, how social norms influence intimate behaviors.
Mm-hmm.
And then the stages become more overtly sexual, right?
Exactly. Mouth-to-breast contact is described as pretty unambiguous body language.
Clear signal.
Yeah, clearly indicating an acceptance of sexuality, potential for arousal, and finally, hand to genitals.
Okay.
Presented as a sign of serious sexual intent, but with a crucial reminder. Timing is key.
Timing really is everything in those moments, isn't it?
Absolutely.
Now, shifting gears a little, Sexopedia delves into different theories about sexual orientation and behavior. One of them is the learning theory. Can you explain the basics of that?
Sure. The learning theory, as presented here, essentially suggests that individuals learn to be homosexual, heterosexual, or bisexual
Yeah.
in much the same way they learn other behaviors and preferences.
Okay. So how does that work?
It proposes that we develop associations between erotic sensations and specific stimuli, whether those are sights, sounds, smells, or even particular types of people.
It's interesting that the book also mentions unconscious rewards in childhood as a potential factor. Can you give an example?
Yeah, the book offers an example where maybe some mothers of transvestites unintentionally rewarded their sons for dressing in girls' clothing.
Oh, okay.
The idea is that these subtle, maybe unconscious positive reinforcements could contribute to a child's developing sense of self and their associations.
And the influence of our peers during those, formative adolescent years is also highlighted.
Yes, definitely. Proponents of this theory believe that the opinions, behaviors, acceptance, rejection from our friend groups during adolescence can also significantly shape our sexual behavior and preferences as we're exploring our identities.
Right. The book then tackles a really fundamental question.
Right.
What truly drives human sexuality? And it brings up Sigmund Freud.
Freud.
Even though some of his specific ideas have been, well, challenged over time, his overall impact was massive, wasn't it?
Oh, absolutely. Freud's concept of the drive, particularly what he called the libido, essentially the psychic energy tied to sexual desire as a primary motivator for human behavior, was incredibly influential.
So he saw it as fundamental.
He believed our sexuality was a fundamental force shaping many aspects of our lives, not just the explicitly sexual ones. Now, while some of his more specific theories, like penis envy, have been widely debated and challenged,
Right.
his emphasis on the power of unconscious drives was truly groundbreaking for its time.
And speaking of influential figures who really shook things up, Sexopedia also discusses Alfred Kinsey's research.
Yes, Kinsey.
Some of his findings were quite surprising then, weren't they? What were some key takeaways?
Kinsey's research, as the book points out, really challenged a lot of the prevailing assumptions and societal norms around sex.
How so?
Well, he found, for example, that women were indeed capable of experiencing pleasure and orgasm, and even multiple orgasms for some women.
Which maybe wasn't widely accepted then.
Not at all. He also revealed how common premarital sex actually was for both men and women.
Right.
And he presented that quite striking statistic that 37% of males reported having had at least one homosexual experience.
Wow, 37%. That must have been controversial.
It really broadened the understanding of what was considered normal sexual behavior.
And his idea of sexual orientation is more of a sliding scale rather than fixed categories. That was pretty revolutionary, too.
It was indeed. Kinsey proposed the spectrum, from exclusive homosexuality to exclusive heterosexuality, with various degrees of bisexuality in between.
The Kinsey scale.
Exactly. What made it controversial, and it's still debated, is that he largely placed individuals on this scale based on the number of sexual acts they'd had with men or women, which many felt overlooked crucial aspects like personal desire, emotional connection, and how people actually identified themselves.
Right. More nuanced than just counting acts.
Precise.
The book then shifts to exploring potential differences in male and female attitudes towards sex. And it starts with a very basic anatomical difference.
Yes, the visibility and accessibility of genitals.
How does that play out, according to the book?
Well, it argues that boys, almost from birth, have direct, easy access to their genitals, leading to an early and often direct connection between touch and sensual pleasure, sometimes without necessarily linking that feeling to a specific person initially.
Okay. And for girls?
For girls, with their genitals being less externally accessible, the experience tends to be quite different, often leading to a later discovery of genital sensuality.
Right.
And potentially a more emotionally connected perspective on love and sex developing alongside that discovery.
So maybe a different developmental path?
The book suggests this difference in early experience might contribute to what it calls object fixation,
Object fixation.
observing that men seem to be perhaps more prone to developing strong sensual responses to specific objects or visual aspects,
Uh-huh.
which could potentially offer one explanation for the higher prevalence of certain sexual fetishes in men.
Interesting. Sexopedia also revisits Freud's impact, specifically mentioning some of his more, well, outdated and frankly problematic teachings,
Yes, some of his ideas haven't aged well.
and how Masters and Johnson's research helped dismantle them.
Absolutely. Some of Freud's ideas, like penis envy in women or the notion that clitoral orgasms were somehow inferior to vaginal orgasm,
Right, those are pretty pervasive.
they were. And as we now know, inaccurate and even harmful. Masters and Johnson's groundbreaking physiological research in the 60s and 70s provided clear scientific evidence against these ideas,
Uh-huh.
playing a crucial role in reshaping women's understanding and beliefs about their own sexuality and capacity for pleasure.
So they really empowered women with knowledge.
Immensely. The book also touches on the observation that men, perhaps linked back to those early, less person-focused sensual experiences, tend to be maybe more likely to seek sex without a strong emotional connection or love.
Okay. Now let's tackle that age-old question. Nature versus nurture in sexuality. Innate differences versus environment. The book touches on both sides.
It does. It emphasizes that while every individual is unique, shaped by personality, upbringing, culture,
Of course.
there are also perceived innate physical, mental, and behavioral differences often attributed to sex.
Any examples?
The book offers a fascinating example, long legs being a turn-on for some men, suggesting this might be linked to a subconscious association from childhood, maybe looking up at adult women.
Wow. Those little psychological connections can be so surprising.
They can. But the book also strongly emphasizes the significant role environmental factors play.
Like upbringing and culture.
Absolutely. Our family background, how we were raised, the cultural norms we're immersed in, they're presented as incredibly influential,
Huh.
shaping our sexual behaviors, our attitudes towards sex, and the learned gender roles we adopt in relationships.
It seems so complex.
It is. The book even brings up the hormonal fluctuations throughout a woman's menstrual cycle and how these can potentially impact her sexual desire and overall well-being across the month.
Right. Let's talk about intimacy. Sexopedia offers a very specific definition of sexual intimacy.
Yes, and it's quite reassuring, I think. It defines it as the ability to make any kind of sexual advance towards your partner with the confidence that it will be understood and accepted.
That really emphasizes trust, doesn't it?
Exactly. It highlights that sexual intimacy isn't something that just happens automatically. It's deeply connected to the foundation of trust that gradually builds in a relationship,
Uh-huh.
often going all the way back to our earliest experiences of intimacy in childhood.
And the book cautions against a really common mistake couples make when intimacy seems to be fading.
Yes, it specifically warns against immediately jumping to conclusions, like suspecting an affair just because sexual interest seems low.
Right. Don't assume the worst.
It encourages couples to prioritize open, honest communication and address any worries before they fester and create distance.
Good advice.
And it offers a hopeful note, too, reassuring that even couples who felt estranged for a long time can often find ways to rekindle those important, intimate feelings.
That's good to hear.
Mm.
Sexopedia also delves into different types of relationships, including more casual ones. How are those defined?
Casual relationships are described as, well, less serious encounters, often fitting into busy lifestyles where partners aren't necessarily each other's top priority. The book suggests it takes a certain level of independence to be comfortable with that,
Sure.
while also acknowledging that sometimes people who might want more settle for a casual arrangement, maybe seeing it as better than complete isolation.
Right. And their chances of lasting.
Generally lower likelihood of long-term survival, as you'd expect. But the book does point out they aren't always static and can sometimes evolve into something more serious.
And what about the complexities surrounding extramarital affairs? How does the book present them?
It acknowledges the various circumstances that might contribute, like maybe a smaller pool of available unmarried partners as people get older.
Uh-huh.
It presents a bit of a paradoxical view, really, highlighting the obvious pain and challenges, lack of a consistent weekend partner, everyday intimacy missing,
Yeah.
alongside some potential, perhaps rationalized advantages, like always seeing each other at their best, having more personal time, maybe focusing more on careers.
Good complex picture. Now, let's touch on a really important message. Learning to love yourself. Sexopedia draws a direct link between self-acceptance and the kind of partners we attract.
That's a crucial point. The book argues that if you have a healthy sense of self-love and acceptance, you're much more likely to attract a partner who will also treat you with respect and affection,
Makes sense.
and vice versa. It then introduces Alfred Adler's theory
Adler. Okay.
that our core belief system about ourselves and relationships is largely formed within our family environment by about age 6.
Age 6? Wow, that early.
Yeah? And this system significantly influences our expectations in close relationships and how we express ourselves sexually later on.
That's powerful. These early experiences having such a lasting impact.
It is. And the book also addresses a common issue for many women regarding self-confidence, particularly around sex.
What's that?
It highlights that many women experience a lack of self-confidence when it comes to discussing or exploring their sexuality. And the book suggests this is often linked to a lack of familiarity with their own bodies, specifically maybe never having masturbated.
Right. Lack of self-knowledge.
Exactly. It then offers several practical tips for building self-confidence. Things like making an effort with appearance, exercise classes, consciously using positive body language to signal interest.
Okay, practical steps.
But it also includes a word of caution, making sure flirtatious behavior is appropriate for the setting, not crossing professional or social boundaries.
Good point. Finding a partner can sometimes feel like, well, navigating a maze. Sexpedia approaches it quite practically.
It does. It frames it as a social system that requires conscious effort,
Yeah.
especially as we get older and those natural social circles from school or uni tend to disperse.
Yeah, it gets harder.
So it suggests actively thinking about where you might meet potential partners for parties, bars, clubs, maybe hobbies,
Right.
and encourages taking the initiative to start conversations while also not taking rejection too personally. It's often not about you.
True. And safety is absolutely paramount when dating, a point the book strongly emphasizes.
Oh, absolutely. It provides basic but essential safety guidelines.
Great.
Being selective about where you meet, ensuring you feel comfortable, not sharing your home address too early, letting a friend know your plans. Basic stuff, but important.
Definitely.
It also underscores being a good listener, showing empathy, asking thoughtful questions on a date, and taking things at a comfortable pace, always respecting your own and your date's boundaries.
Communication again. It seems to be the foundation of everything.
It really is.
Yeah.
And Sexopedia outlines what an ideal conversation in a relationship should look like.
Okay, what's the ideal?
According to the book, it's a clear flow. One person talks, the other actively listens without interrupting.
Actively listens, nodding, feedback.
Exactly. Nonverbal cues, maybe brief comments. Then the listener seeks clarification, asks questions, offers suggestions. The talker responds openly, positively, and crucially, both follow through on any actions or promises made.
Right, follow through is key.
The book encourages listeners to reflect on their own communication patterns. Where could they improve?
Self-reflection. Good idea. Even in the early passionate stages of a relationship, Sexopedia points out potential challenges.
Yeah, like balancing the demands of a new love life with work pressures. That's a common one.
Definitely.
The book even suggests, quite practically, timetabling.
Timetabling your love life.
Well, timetabling your time generally to manage it effectively. It also notes that as relationships get serious, moving in together often becomes a natural step, partly as a way to maximize time together amidst busy lives.
Makes sense. And thinking long-term, Sexopedia raises that fundamental question. What do you actually want from a relationship?
Yeah, it briefly touches on how differing expectations can be a major tripwire, leading to conflict down the line. It suggests it can be incredibly valuable for couples to openly discuss and compare their family backgrounds and the expectations they've developed.
Talk about it early.
Exactly. It even briefly mentions non-monogamous relationship structures and swinging as alternative models some couples explore.
Okay, now let's get into some of the more specific anatomical details. Yeah. Sexopedia explains male sexual anatomy, starting with sperm production.
Right. It explains sperm are produced in the testes, then mature, and are stored in the epididymis.
Okay.
During arousal and ejaculation, they travel through the vas deferens to the seminal vesicle, mix with seminal fluid from the prostate gland and other bits. And this mixture, semen, is then expelled through the urethra.
Got it.
The book also clarifies something important. Orgasm and ejaculation are separate physiological processes.
Oh, really?
Yeah, meaning it's possible for some men to have multiple orgasms without ejaculating each time.
Interesting. And turning to female anatomy, the book focuses on the vulva. Can you describe its main parts?
Sure. The vulva includes the labia majora, the outer folds protecting everything else.
Right.
Then the labia minora, the inner folds containing glands for lubrication. The clitoris, highly sensitive, packed with nerve endings. And the opening to the vagina, the muscular canal to the uterus. It also mentions the perineum, the sensitive skin between the vagina and anus.
Okay.
It notes labia size varies greatly, and recent research shows functional similarities between aroused male and female genitals.
Hormones play such a critical role. Sexopedia specifically discusses testosterone.
Absolutely essential, especially for male development. It determines male sex in the fetus around week 6.
Wow.
Then it surges during puberty, driving genital growth, secondary characteristics like facial hair, deeper voice, and beyond puberty, it's vital for muscle mass, energy, and of course, sex drive in men.
Right. The book then revisits the sexual spectrum concept, referencing Kinsey again.
Yes, reminding us of Kinsey's idea of that continuum of orientation based on the number of sexual acts. But it also reiterates the critique that it emphasizes behavior over internal feelings like desire and identity.
Right, the nuance. And it's crucial to remember our sex drive isn't just hormones, is it?
Absolutely not. Sexopedia stresses that emotional and mental factors, stress, mood, relationship satisfaction, beliefs, play a huge role.
Often more than just the physical.
Often, yes. Maybe even more so than purely physical or hormonal factors sometimes.
The menstrual cycle is key for female biology. Quick overview from the book.
The average cycle is about 28 days, variable though. Key hormones are FSH and LH, controlling egg development and ovulation.
Oh, wait.
Then estrogen and progesterone prepare the uterine lining for a potential pregnancy. These hormonal shifts can influence energy, mood, and sexual desire throughout the month.
And when fertilization happens, how is the baby's sex determined?
Fertilization usually happens in the fallopian tube. The fertilized egg implants in the uterus lining.
Right.
The sex is determined instantly by the sperm's chromosome. X gives a girl, XX. Y gives a boy, XY.
Simple as that.
Pretty much. It also briefly mentions non-identical twins, 2 separate eggs fertilized by 2 separate sperm.
Okay. The physical act of sex involves a cascade of physiological changes.
Yes, in both sexes. During arousal, blood flow increases to the genitals, erection in men, lubrication in women.
Wow.
Heart rate, breathing, muscle tension all increase. At orgasm, men typically ejaculate semen. Women experience rhythmic contractions in the vagina and uterus. The cervix might even dip slightly.
Wow. Setting the right atmosphere can really enhance things. Sexopedia offers ideas for a sensual environment.
It does. Suggests warm colors like reds, purples, pinks. Luxurious fabrics for touch.
Nice.
For minimalists, maybe white and pale hues, accented with a few red rose petals, references American Beauty and the Kama Sutra there.
Well,
And a massage in front of a fire warmth, soft lighting highlighted as incredibly sensual.
and the art of massage itself. Key principles from the book.
Slow, deliberate movements are key. Warm massage oil in your hands first. Don't pour it directly on the body.
Right. Avoids the shock.
Exactly. It emphasizes almost any touch feels wonderful if done slowly, intentionally. Suggests starting with broad circular movements.
Yeah.
And importantly, communicate. Ask your partner what they enjoy, what pressure feels good. Preferences vary hugely.
Communication again.
Yeah.
Specific techniques mentioned.
The torso glide, long sweeping strokes up the torso, around the shoulders is great for relaxing the upper body. For foot massage, gentle toe bending, small circles on the soles with thumbs. And don't underestimate a scalp massage, maybe during shampooing, surprisingly sensual.
Good tips. Kissing is so intimate. Sexopedia even draws from the Kama Sutra.
It does. Explains how different kisses convey different emotions, from affection to lust.
Right.
Mentions sensitive areas like inner thighs, breasts, nipples, throat, respond well to kissing. Gives Kama Sutra examples. A light lip brush, measured kisses along the spine, a pressed kiss with gentle pressure on the stomach, the turned kiss with a tilted head for deeper contact.
Fascinating detail. Self-touch is important for self-discovery. Advice for men.
Suggests starting gently with the flaccid penis, retracting foreskin if uncircumcised. Use lubricant. Once erect, focus on stimulating the head, maybe grasping the ridge, moving skin back and forth. Highlights the frenulum, underside of the head, as particularly sensitive.
Okay. And for women.
Advises starting relaxed warm bath, all over body massage, initially avoiding genitals, just noticing erotic sensation.
I'll go gradually.
Exactly. Then progress to genital pleasuring labia, Clitoris, vaginal opening, noting what feels good. Usually a light touch on the clitoris initially.
Right.
Cautions against forcing orgasm. Focus on exploring pleasure. Suggests finding the most sensitive spot, often at the vaginal entrance. Mentions trying caressing through silk or using vibrators.
Yeah, lots of options when it comes to partner play. Tips for giving her pleasure.
Suggests starting with casual exploratory touch of labia and clitoris to gauge response for more direct stimulation. Gentle twirling rubbing on the clitoris head size, rubbing back forth beneath, slowly up over across. Communication and attention to reactions are key.
Communication always. Oral sex techniques.
For him, kissing the tip, tongue twirling around the head, focusing on the coronal ridge and frenulum, then maybe sucking the whole penis.
Okay.
For her. Tongue along between labia, inserting tongue shallowly deeply into vagina, gently stimulating clitoris, often from underneath as direct pressure can be too much.
Got it. Food as a sex aid sounds fun. What's the appeal?
The book says it's the sensory qualities, slippery, sticky, juicy textures mirroring intimacy.
The text.
Also, how the act of eating itself can be suggestive. Describes playful games like decorating the body with honey or whipped cream and licking it off.
Yeah? Could get messy.
Part of the fun, maybe.
Now, the physiological stages of sexual response. Desire, arousal.
Desire, arousal, orgasm, resolution. During arousal, similar changes in both. Blood flow to genitals, perspiration, nipples erect, increased heart rate, blood pressure, breathing, muscle tension.
Remarkable similarities, as the book notes.
Yes, but specific physical signs differ too.
So for women, during arousal?
Starts with stimulation. Physical, mental. Breast swelling, nipple erection, muscle tension, increased heart rate, breathing. Vaginal lubrication happens, vagina lengthens, swells. Tenting?
Venting.
Yeah. Labia swell, clitoris engorges, can make it seem to retract or disappear due to surrounding swelling.
Okay. And reaching orgasm for women?
Can involve rhythmic contractions, vagina, clitoris, uterus, other muscles. Maybe increased wetness. Unlike most men, many women can delay orgasm, potentially have multiple orgasms. But the book notes a minority never experience it, though therapy can sometimes help.
Right. Sexopedia gives techniques for female orgasm. Acknowledging intercourse alone often isn't enough.
Yes. Emphasizes the clitoris as the main sensation organ for most women.
So combinations work best.
Intercourse plus manual clitoral stimulation is very common and effective. Also mentions the sandwich position partner's hand stimulates clitoris during intercourse, and various direct clitoral massage techniques.
Okay. Different positions, rear entry. What's the appeal there?
Often described as exciting novelty, taste of the forbidden, maybe links to submission dominance for some. Can be erotic for both. Women might like the feeling of being taken, different angle. Men often enjoy the depth, the visual. Variations like lifting a leg enhance sensations.
And positions for deep penetration.
Describes woman on her back, man kneeling, her legs over his shoulders, allows very deep penetration.
Sensation.
Feeling full contained for him, maybe vulnerable, intensely stimulated for her. Men can find the visual of her legs arousing too.
Using props like chairs and sinks.
Suggests they open up wonderfully sensual positions otherwise impossible. Also hints at the power of imagination, unusual locations, sparking erotic stories, role play.
Increasing friction during sex.
Techniques mentioned.
The grind. Man maintains deep penetration, focuses on pelvic pushing, circling, less in-out thrusting.
Okay.
The seizure. Man uses hand to gently hold back woman's pubic mound, pressing her clitoris more directly against his penis. Increases friction there.
Got it. And massage during intercourse. Advice is against just focusing on thrusting. Remember the skin. It's the largest sensory organ.
Right.
Encourage hands to wander freely over each other's bodies. Describes a technique combining intercourse with back massage, simultaneous pleasure, and relaxation.
Anal sex, sometimes controversial. How does Sexopedia handle it?
Very openly, matter-of-factly. Acknowledges many find it natural, sensual due to nerve endings.
Addresses concerns?
Yes, hygiene and pain. Emphasizes thorough cleanliness, especially before vaginal sex after, and the absolute necessity of lots of water-based lubricant.
Lubricant is key.
Crucial. Stresses gentle exploration, gradual progression, open communication about comfort. Suggests tongue-licking probing as sensual prelude. Mentions further exploration like prostate stimulation for men, simultaneous anal fingering clitoral stimulation for women. Notes effective anal sex toys exist.
But always consensual.
Absolutely. Never force it, respect objections, maybe step back to a more comfortable level if needed.
Good advice. Boredom killer. Yeah. Sex outside the bedroom.
Suggests spontaneity kitchen lovemaking. Mentions the raw edge of hard work tops.
Yeah.
Also, sex by a fire warmth, light sense of adventure.
Acting out fantasies.
Yeah.
Benefits.
Connects it to playful childhood role play. Teasing, make-believe builds anticipation, intense desire.
Enhance it how?
Suggests new venues, hotel, friends, empty apartment for novelty. Mentions blindfolds heightening imagination, other senses.
Bondage games.
Yeah.
For the more adventurous.
Explains it can reawaken sexual imagination if things get routine. Addresses fears of harm by stressing absolute trust and communication are vital.
Trust is paramount.
Yes, paradoxically, relinquishing control can represent extreme trust. Stresses clear boundaries, enthusiastic consent, a safe word.
Safety first.
Always. Recommends starting mild, building slowly. Mentions props from silk scarves to commercial kits.
Spanking and cating.
Explains light slapping, tapping, brings blood to surface, creates erotic arousal, tingling, warmth. Emphasizes sting, not pain injury.
Important distinction.
Very. Remove rings first. Test cane on your own hand. Crucial to know what partner wants. Stop if it causes real pain. Differentiate pretend pain from actual discomfort.
Got it. Sex toys overview.
Categories. Vibrators, huge variety, shape, size, speeds, external and internal. Dildos, solo partner strap-ons, cock rings, enhance erection, anal wands, prostate massage.
Civic uses.
Strap-on vibrator for clitoral stimulation during intercourse. Tiny finger vibrators for surprises.
Looking sexy appearance and self-feeling.
Suggests experimenting makeup, hair, find what makes you feel confident. Highlights symbolic power of sexy underwear, affects self-perception and partner desire. Recommends men choose underwear partners find attractive. Maybe make a fun list together of likes, dislikes.
High heels and long legs phenomenon. Psychology behind it.
Explains a psychological theory. Might stem from childhood fixation on objects accidentally associated with sexuality early on.
Interesting.
Notes historical awareness of sex workers about the pulling power of heels, seamed stockings, boots.
Sensual materials.
Recommends incorporating velvet silk. Suggests a dedicated sensuous evening exploring fabrics. Silk, velvet, fur, leather, rubber, vinyl, even plastic wrap canvas.
Wow, texture exploration.
Describes using a velvet strand as blindfold in heated, scented room. Soft fabrics, tea-stepped. Rubber leather cling, a squeeze. Perhaps heat perspiration can increase passion.
Fetishes, intense sexual interests. How defined?
Intense, persistent focus on non-genital body parts, non-living objects, specific situations. Mentions potential brain cross-wiring.
Examples listed.
Quite a few from the source. Amputee, Cinderella, podophilia feet, defilement, mud wrestling, necrophilia, pony racing, public speaking, homophilia, high heel, altacalcophilia, string plastic wrap bondage, telephonic-ophilia, vampirism.
Wide range, modern relationships, cohabitation.
Discusses increasing trend over enriching marriage, more carefree way to enjoy sex life without full responsibilities. Introduces singles cohabitation, briefly mentions communal marriage, group living, agreed fidelity.
Sex parties and orgies.
Describes rise of swingers parties in 70s. Orgies as extension mass, indiscriminate sex. Notes decline due to AIDS concerns. Mentions historical precedents like French partous.
Transsexuality aspects covered.
Highlights transvestites' love of makeup women's clothing. Gives 1974 UK stats, male to female versus female to male. Shares Raymond Thompson's experience.
Medical aspects.
Explains some outgrow it, many seek reassignment surgery, hormones, cosmetic surgery. Stresses variety within the term transsexual.
Gay issues prevalence question.
References Kinsey, potentially high figures versus 1994 British survey, lower figures. Defines bisexuality, attraction to both. Mentions Masters and Ronson suggesting its point of sexual sophistication. Notes survey findings. Heterosexual identifiers with past same-sex experiences. Link between high sex drive and varied outlets. Gives 1994 UK gay stats.
Telling parents about being gay, sensitive topic. Advice.
Acknowledges differing counselor opinions. Cautions about potential negative reactions, violence, disownment. Prioritize safety, refrain if unsafe.
Difficult balance.
Very. Acknowledges burden of concealing identity. Suggests tactful ways to break news. Strongly recommends having counseling organization contacts ready if expecting negativity.
Meeting other gay individuals.
Notes harder in rural areas, easier in big cities. Suggests gay bars clubs, magazine classifieds, internet, chat rooms, matchmaker sites.
Origins of homosexuality theories.
Genetic. Studies on brothers, X chromosomes, XQ28 region, notes lack of similar pattern in lesbians. Hormonal, fetal brain masculinization, feminization, but disproven hormonal abnormalities post-birth in most. Brain structure. Conflicting reports. INAH3 hypothalamic nucleus study mentioned, but limited.
Pelvic floor exercises recommended for both.
Yes, for women. Contract muscles as if stopping urination, hold, release, repeat. Benefits bladder anal control, sexual sensation. Gives specific exercise involving squeezing cushion, etc.
For men,
Strong pelvic floor muscles can help maintain erections, delay ejaculation.
herbal remedies mentioned.
Briefly, Agnes castus, hormone balance, warns re-HRT interaction. Ginkgo biloba, circulation, PMS, breast pain, cognition. Rhodiola rosea, physical energy, used by athletes cosmonauts. Celery, fennel, soybeans, natural phytoestrogens. Ginseng, stress relief, take for 3 months.
Personal care for sexual health. Key practices.
Emphasizes hygiene, safe for sex. Strongly recommends regular self-checks, breast testicular abnormalities, professional checks, pap smears, prostate exams. Provides what to look for, lists for self-exams.
Visiting a sexual health clinic, what to expect.
Reasons: known infection, partner notification, routine checkup, pre-new relationship check. Expect discussion of sexual history, physical exam, maybe immediate treatment, antibiotics, antivirals.
Follow-up.
Yes, follow-up info, advice on preventing transmission reinfection, future STIs, sometimes counseling. Describes pap smear, detects precancerous cervical cells, mammography, early breast cancer detection.
Safer sex practice is crucial. Guidelines.
Defined as reducing risk, STIs, unwanted pregnancy. Recommends condoms consistently for penetrative sex. Also for lower risk like mutual masturbation involving genital contact.
Lower risk activities.
Kissing, body licking generally low risk. Caution about unprotected oral sex unless both partners tested clean.
Anal sex safety.
Plenty of water-based lube, extra strong condoms, slow gentle, wash thoroughly before vaginal sex after.
Communication with partners.
Underscores open, honest conversations about sexual health. Suggests sharing status, maybe joint clinic visit. Notes monogamy needed for unprotected sex after both tests clear.
Contraception fundamental. Definition in categories.
Preventing sperm-ovum union. Categories. Barrier, prevent sperm travel. Hormonal, prevent ovulation. Intrauterine devices. IUDs prevent implantation. Sterilization, permanent. Natural, abstinence on fertile days.
Specific methods.
Lists monitoring body temp, natural.
Right.
And female condom, diaphragm cap, barrier. Combined pill, progestogen-only pill, injectables, implant hormonal. IUDs, tubal ligation, vasectomy, sterilization, abstinence.
Need to know effective.
Yes, be aware of efficiency and limits of each. Gives more detail on female condoms, diaphragms. Explains hormonal methods, alter cycle using lab hormones. Pills, injections, implants, hypertection, potential side effects.
Pills.
Combined pill, estrogen progestogen, suppresses ovulation, 28-day cycle, withdrawal bleed, high effectiveness, potential side effects, not for all women. Progestogen-only pill thickens cervical mucus, may suppress ovulation. Daily, same time, crucial, high effectiveness, suits smokers over 35 breastfeeding.
Other methods.
Briefly mentions injectables, implant, IUD, IUS. Explains tubal ligation vasectomy are permanent, no effect on hormones desire.
Issue of ignored contraception.
Addresses this in early sexual experiences leading to teen pregnancy STIs. Emphasizes condom use, empowering young people to say no to unprotected premature sex.
Sex during pregnancy.
Guidance. Advises lovemaking possible, comfortable positions key, harder in third trimester. Suggests non-penetrative intimacy, masturbation massage.
Masturbation during pregnancy.
Good way to relieve tension, maybe stronger orgasms. Reassures orgasmic contractions unlikely to induce labor unless body ready. Caution with intercourse if history of miscarriage, water breakage.
Positions. Starting labor.
Woman on top or side by side later. Intercourse near end is time-honored, not guaranteed. Way to potentially start labor. Prostaglandins and semen. Reassures won't cause premature labor if not ready. Consult doc if history of premature labor.
Sex after pregnancy. Adjustments needed.
Reassures enjoyment possible, takes time, patience. Tips for women: be patient, communicate, use lube, try positions, continue pelvic floor exercises, prioritize intimacy.
It's for men.
Be patient, understanding, compliment partner, don't nag, talk needs compromise, it's just non-penetrative if intercourse uncomfortable.
Retaining intimacy.
Emphasizes other ways: bath together, date nights, accept help for time off. Stress communication, humor, sharing anxieties. Highlights emotional closeness often felt after birth.
Sex in the middle years. Changes.
Discusses menopause, women, lower drive, hot flashes, dryness, and andropause. Men, low libido, fatigue, weaker erections. Mentions HRT for menopause.
Traps of middle-aged sex.
2 common ones: boring lovemaking, stopping sex altogether.
Tips for good sex life then.
Talk openly, prioritize sex, be adventurous, self-massage, stay fit, healthy diet, Don't use fatigue excuse always, care about appearance, positive thinking, debunks aging myths.
Depression and sex.
Connection. Explains depression often lowers libido. Suggests two-pronged approach, psychotherapy on depressants, plus self-help. Exercise, diet, sleep.
Men's problems, erectile dysfunction, ED, causes.
Illness, aging, testosterone decline. Medications can affect it. Not inevitable with age. Often responds to direct friction. Mentions hormone treatment.
Risk factors.
Smokers, drinkers particularly vulnerable. Cardiovascular nervous system damage, lower testosterone. Mentions sex therapy for psychological issues. Penis rings for venous leakage.
Women's problems, menopausal changes beyond dryness.
List mood swings, anxiety, sleep problems, concentration issues, vaginal itchiness. Suggests self-help, lube, longer foreplay, positions, talking. Mentions HRT, restoring estrogen, relieving symptoms.
Illness impacting sex.
Briefly touches on chronic illnesses, heart disease, diabetes, arthritis, cancer, MS, spinal cord injury, affecting function differently. Spinal injuries may affect men, erection more, but many women report satisfactory sex lives. Men with MS might not respond to fantasy with erection, but may respond to touch.
Medication side effects on sex.
Explains some prescriptions have side effects, but sometimes illness itself is the cause. Lists antidepressant examples, libido, erection, ejaculation, orgasm effects.
Hormonal meds.
Oral contraceptives, variable desire effects, potential dryness. Androgens like testosterone may restore drive orgasm. High doses cause masculine features in women. Briefly notes blood lipid pressure meds affecting function. Warns against poppers plus Viagra, blood pressure drop.
Illicit drugs and sex. Cautionary view.
Strongly warns against using them for enhancement due to risks, impaired drive performance. Recommends therapy doctor consult for approved drugs.
Specific drugs.
Alcohol reduces testosterone, nerve issues, kills drive, sperm abnormalities. Marijuana can reduce testosterone, cause impotence, sperm ovarian damage. Amyl nitrite poppers, lightheaded, enhances orgasm, dangerous with Viagra. LSD mushrooms, unpredictable libido effect, variable sensation, prolonged orgasm, long-term psychotic risks.
Sexually transmitted infections, STIs. Important topic.
Explains most transmitted sexually, some triggered by sex. Lists describes genital herpes, itchy tingling, blisters, painful sores, recurrent. Chlamydia, often mild and notice, burning urination in men, antibiotic treatment. HIV, destroys immune system.
General advice is suspected STI.
See doctor promptly. Inform partners. Avoid sex until clear. Good hygiene. Practice safer sex.
When sex goes wrong, relationship problems and therapy. Case studies summarized.
Yes, illustrates various issues approaches. Anger post-childbirth, decreased intimacy, fixed via communication, shared activities, husband demanding, cyber wife feels like caregiver, rediscover lover role, equal partnership, relocation, stress, intimacy issues, communication exercises, bereavement, difficulty with new intimacy, grieving process focus, wife's low libido from stress, understanding support, couples differing needs timing, mutual masturbation, sensate focus, squeeze technique, loss of desired, renew intimate connections, joint activities, marital harmony program, psychological ED from guilt, therapy, prioritizing marriage, husband's low desire from business stress, support, address underlying problem, wife's low desire plus husband critical, therapy for inferiority acting as if exercise, wife's sexual inhibition despite desire, assertion exercises, potential meds.
Wow, covers a lot. Finally, a look back. History of sex.
Acknowledges unknown attitudes of earliest ancestors. Cro-Magnon. Cave paintings suggest sex played role, maybe linked to magic rituals.
Clearer with writing.
Yes, ancient Greece, Rome. Different lives, men, women in Greece. Explicit Roman art customs. Ancient China, Japan viewed sex as art. Taoixian geisha rituals. Mentions foot binding, China. Floating world geishas, Japan. Sex bartering, Polynesia.
Victorian era.
Suppression, but private freedom for aristocracy, pornography. Late 19th, see scientific study begins, terms hetero-homosexual, wider condom use, rubber advances.
20th century.
Sexual revolution, looser fashions, sex in media, key figures, Magnus Hirschfeld, Margaret Sanger, recent advances, chemical cures, Viagra, hormones, emphasis on health exercise for longer sex life, digital tech impact, internet.
And for anyone wanting more info or support, Sexopedia lists resources.
Yes, provides contacts. American Association of Sex Educators, Counselors and Therapists, American Social Health Association, Antopia, the Canadian Rainbow Health Coalition, Board of Examiners in Sex Therapy and Counseling in Ontario, Canadian Association of Sexual Assault Centers.
Wow, that was an incredibly comprehensive deep dive into Ann Hooper's Sexopedia. We really covered, well, a vast amount of ground.
We certainly did.
from the biological and psychological foundations of sex and attraction to relationship complexities, history, and those crucial resources for sexual health.
Indeed. And we hope this exploration has given you, our listener, a much clearer, maybe more nuanced understanding of these multifaceted topics.
Yeah.
Ultimately, a deeper knowledge of our own sexuality and that of others can lead to greater self-awareness, healthier, more fulfilling relationships.
And a more satisfying sexual life overall.
Exactly.
And on that thought, here's something to maybe ponder. Perhaps the most fascinating aspect of human sexuality isn't just its biological roots or its diverse social expressions, but rather that deeply personal, constantly evolving journey of understanding our own unique desires, needs, and how we connect with others on such an intimate level.
Well said.
We encourage you to continue exploring these topics in your own life and maybe even revisit Sexopedia itself for even more insights down the road.